Hi, I'm Stephanie, the PT with the Note Ninjas, and together with Nicole, the OT, we help other therapists, PTs, OTs, and assistants with treatment planning and documentation. So today I'm going to talk about something very important. It's about how everything we do in therapy needs to be related to a functional goal. If you're doing it in therapy, there has to be a reason for it, something the patient wants to get back to. It doesn't matter if what it is within normal limits or the maximum strength or whatever it is. You just need to be doing what the patient actually needs to get to whatever their goals are. So, for example, if you are working on shoulder range of motion, why do we need to work on that? What does the patient want to get back to? Maybe they want to get back to hanging their clothes in the closet or taking a dish down from a cabinet in the kitchen. How much flexion, range of motion does that patient need to be able to do that activity? And that's what you need to be working on. So if your patient only needs 160 degrees to do all of those things, you should be working on 160 degrees of shoulder flexion range of motion, not full range of motion. Why? The patient doesn't need that functionally. Insurances won't pay for it, and it's not necessary for your patient. We also have all the activities we do have to relate to function. Let's watch a short video with some functional activities and what it ties to. So as you saw from the video, we had our patient doing different activities that we could be doing in the clinic or at home or in rehab, then what activities it could be working on that they want to get back to. And just make sure to document this. You might know it in your head. We also have to tell a possible chart reviewer why we are doing the activities. We were doing arm range of motion in order to clean the windows. That is what is related to. That's the activity we are doing and what it was related to. And you don't have to do it every single time, but make sure it is in there. And then don't forget, besides tying it to a functional activity, you also have to say why you were there. Why can the patient not do it with just a caregiver or a family member or a friend? Why do they need the skill of a physical or an occupational therapist? Were you providing tactile cues for muscle recruitment? Were you giving a manual assist to help with the range of motion? Were you giving verbal cues for posture? Whatever it was that you were doing that they needed your skill needs to be in your documentation. Because if it's not, the reviewer might say, well, why do they need to be there? Why can't they do that on their own? And they won't pay for it. So we need to be showing this in our notes all the time. So I hope this helped. Make sure to follow us at the Note Ninjas for more skilled care and documentation tips.